Hi guys, how are y'all? My name is Ketki and I'm a student at UT Health Science Center San Antonio School of Dentistry in the International Dentist Education Program. Um, the purpose of my video is recently there are so many students who are contacting me trying to figure out how to apply, what all things to do, what all things to study. So I thought I'll just make this video and explain everything and summarize everything for y'all. I wanted to do this for a very long time, but I just didn't get time because dental school is so busy. Anyway, so let me introduce myself. I graduated dental school in India in 2010, and then I did my master's in prosthodontics. I finished that in 2015, and then I was working in a school as an assistant professor in the Department of Prosthodontics. I was also doing some consulting, going to some of the clinics around Mumbai, and I would just see a lot of different kind of patients there. And then of course I moved to US, and I started doing all the things required. Now this is also my very first video, so just excuse me or forgive me if I make any mistakes. Anyway, I knew that I had to do some exams in the beginning, so I kind of wrote on this board what all things are important and key aspects of figuring out the whole process of getting into a dental school and your license. So the main three exams which you have to give are TOEFL, NBD Part 1 and 2, but now I think from next year they're going to start a new type of NBD. It's called as INBD or Integrated NPD, in which they are not going to have Part 1 and Part 2. They're going to combine both NBD Part 1 and Part 2, and they are also making the syllabus in schools very integrated. Like usually in the first and the second years, the student would be only in the sim labs and trying to like read a lot, but now the syllabus is changing. They're kind of having a lot of first and the second years come help us out in the clinic, so that they get more clinic exposure and they learn better. So from next year, I'm not very sure about this, but they're pretty much going to start this integrated NBD, and this is very new. Even I don't know about it. So for them who are gonna give this, good luck to y'all. Part 1 and Part 2. Part 1 I had to study quite a lot, because we were not used to anatomy, physiology, biochemistry and all that stuff. So I had studied it long back, so I took more time to study. And Part 2 is more clinical. It's like more like operative, endo. If a patient comes in, he has this medical history, what are the recommendations, what changes, what will you do, and they'll give you a x-ray of like a tooth with a periapical lesion. They'll not directly tell you what happened, but they'll kind of indirectly tell you what is going on, and then you have to do the diagnosis, and then you have to also maybe give a treatment. Part 1 is just one day. It's like a 8-hour exam. It's very tiring. You get breaks in between, but still using your brains for 8 hours is quite a task. Part 2 is 2 days. The first day is like 8-hour exam, but you can finish it sooner and you can leave. The second part is more like testlet based. It's more of case based questions. So they'll give you one case and you'll have to like answer maybe 10 questions related to that case. TOEFL, usually it can be a little tricky because you have to speak on like a microphone and a headphone for about like 30 seconds or 60 seconds, and sometimes it can get a little challenging. So suggestion for TOEFL, I think, would be just practice a lot. Like me and my friend, we would just discuss, like say about one, just discuss one topic, and we will record it, and then we'll send our recordings to each other, and we'll try to give some tips as to how to improve this part, how to improve that part. Essay writing, you have to like read. There are also a lot of videos on YouTube, which is called as noteful.com. Just write it down here. This was really helpful for me for TOEFL. All the beginners, I think you should watch noteful.com. Speak with your colleagues. Essay writing, you should write and then send it to a person who you know or you think have good vocabulary. Listening, it's very, I think, tough also, because you have to listen and write down what all points they talk, and sometimes they can ask you very particular questions like, you know, what did this person think, or what did that person think, which when you're listening you don't feel it's very important, but they'll trick you and they'll ask you question about that particular thing. So you have to be like aware of it. Now it's also very important to see, like in TOEFL, that you don't really listen to what the adjacent person is talking, because what happens is when you start speaking, the adjacent person can also start their speaking section for TOEFL. So both of them speaking and the noise cancelling headphones, they don't really help all the time. So make sure that you are like focused on yourself. Try to like adjust the headphones so that you can clearly listen to the voice and speak also. Be very slow and clear when you're talking. For me, I think TOEFL was more challenging than NBD part 1 and 2. So on my first attempt, I got like about 98. And I know that most of the schools like a score of 100 and above. So I gave it the second time, and the second time I got 106. So I think I was okay there. Part 1 and part 2, there are a lot of things you can read. I'm sure you'll find a lot of information on the internet. After you do this 3 exams, don't be very happy, because the real struggle is right here. Your documents, your applications, interviews, bench tests, so many things. Documents, the main documents which you require are SOP, the statement of purpose, LOR, the letter of recommendation, transcripts, and any attested documents, and any other documents like degrees or any certificates you have, all those. Now SOP and LOR are very important. Make sure that you write it really precisely, and make sure that you send your SOP to like at least 2-3 people with good vocabulary and with some experience, and they can give you some tips as to like include this, include that, don't put this sounds very weird, and things like that. It should show, the SOP should show how interested you are, how much interested you are in doing this program, and basically is you like how you convince the person who's reading your SOP. It should have your story in it. It should also, I mean, I kind of asked for some help from some professionals. You can do that, but you also have to like put in your efforts. Like it shouldn't be directly like written by somebody who doesn't know anything about your life, you know. You should also equally contribute to writing your SOP, I think. Also, letter of recommendation is equally important. They have to be like in a sealed envelope, okay, and you at least need 7 to 8. Like at least I had taken 7 or 8, because I didn't know how many schools I was going to apply to. So I wrote down that, and some of the faculties or some of the teachers, they like for you to go to them, show them what you have written, and sometimes they can also give you some additional tips, and you can like go with your laptop to them, so you can just edit it and get a printout, get their letterhead. So, and it has to be on a letterhead which is stamped and signed by them. Okay, and you also need envelopes in which you'll put those letters, and then when you seal it, they have to have a signature on that. You can also put some stamps on the seal which shows that okay, it's sealed and we've not tried to open it or something. Transcripts are similar. You need to ask your school about those transcripts. So every school has a different process. You also, like if you are in Maharashtra in India, the university takes separate money and your school takes separate money to figure out and to type those transcripts for you. Make sure whoever does your transcripts, make sure that you see the documents before they actually send it to the university. Like you have a proof of all your marks, because it's a big sheet and it includes all your 4 years. So any mistake can cost you a lot, because those are also going to be used to do your GPA evaluation when you send it to the ECE. Now, this is one more thing which I forgot to write here. There is something which is called as ECE. For US, most of the schools accept ECE. This is like an evaluation committee here, or organization, in which you send your attested mark sheets. So the attested mark sheets are coming from the university. So you'll have your mark sheet and your university will kind of stamp and sign it and again seal it and then send it to ECE. And the ECE will send you a report. I think it's about 3-4 weeks, something like that, or 2 to 3 weeks. I'm not very sure, I forgot. But I think it's about that time. They will send you a GPA, and the dental schools will use that GPA to kind of place you in their rankings. This was one other thing. And all the other documents which you have, your certificates, your mark sheets, your degrees, all these, of course, you need to like carry it when you're coming here. Then after doing all this, you start your application. Now, if you want to do DDS or DMD, which is like the basic licensing course, you apply to CAPID. Okay, there is a website which is called as capid.org. Go there, make your profile. Okay, and if you're interested in specializing, like if you think that you don't want to do this, you want to specialize, you want to do pros, you want to do peds, you want to do ortho, endo, whatever, you can apply to PASS. It's PASS. And honestly, I've not applied to PASS, so I cannot tell you much about it, but it's like a application in which you will rank 3 schools according to order, and the school will rank you according to their preference, and if both of them match, then you get accepted. It's like a little complicated process, but once you read it, I think you'll get a hang of it. After this, so after CAPID is like a general website. Like you make your profile, right? You make like a Facebook profile, so you give up all the information on the website. Now in CAPID, there are multiple schools. Okay, you select which school you want to go to. The CAPID also has deadlines for the application. So if you want to apply to say UCSF, you just go there, just hit submit, and all your information goes to UCSF, whatever you have entered in CAPID. Okay, now CAPID has, if you select UCSF, now they will also have a supplementary application. Okay, so there is a main application and then there is a supplementary application. Supplementary application is because CAPID is like a big organization, and if suppose there is a school who needs more information about you, they can ask you some more documents from them, and of course there is different money. So if you, for the main application, there is some money involved, and so the supplementary application, again there is a money involved. Now one more thing, in CAPID, whatever NBD scores, your TOEFL scores, whatever exams you give, all the scores have to be sent to CAPID. So NBD part 1 and part 2, all these scores have to be registered in CAPID. So the schools who are looking at your application, they can figure out, okay, you know, this person has got this much in TOEFL, this much, and they've passed NBD, blah blah blah. After you send these 2 applications, then is the wait game. You just cross your fingers, you hope that some school will call you for interview, and I think this would be also a good time to start with your bench test preparation. Now, if you ask me about applications to different schools, I had applied to like 15 schools, just because this process is so time consuming, so frustrating, and it involves a lot of hard work, like a lot of paperwork actually. So I was like, I don't want to do this again the next year, because the LOR is valid only for 1 year. Suppose you make all your transcripts apply in one cycle, like suppose 2020 cycle, and if at all you don't get into, you have to again make a new letter of recommendation. So that is again going back to your school, to your professors, getting their signatures and all that. So I was like, I don't want to do this, I want to get in this year, and I made like every possible effort to and made sure that I get into any dental school this cycle. Okay. So once that happens, they will call you for interview. Every school has a different process, but I can give you a general idea of how the interview is. So interview has 2 parts. One is like the main interview, and second part is like a bench test. Bench test is just working on a typodont in a lab. So every school has different things. Whenever you get an email, you will also get an information of what all things they are expecting from you. For interview, I think you should be ready for answering basic questions like, why do you want to come to this school? Why did you choose to do DDS? What do you have any family around here? Say like, what are your motivational, like what inspires you? Also, like, what are the challenges you faced in your dental career till now, and what all things you did to prevent those things from happening in your life. Some other interviews might ask you like, if this happens to a patient, like they can ask you case-based questions also, they can ask you ethical questions also, like you know, the 5 principles of ethics: do no harm, malfeasance, beneficence, all that. I don't even remember all 4, sorry, right now. So they can ask you those type of questions. They can ask you general questions about family. Some schools can be pretty intense, like they'll grill you about your dental stuff. Not like, they won't ask you like definition or anything. They don't ask you definitions here, but they will ask you scenarios like, if at all a patient is here, he's not ready to accept treatment, even though you think that it's good for the patient, what will you do? Things like that. So it's pretty general. It's not like something very crazy, but of course you should be prepared to answer some of the questions, because we are honestly not used to such interviews. In India, it is always about giving an entrance exam. Whoever gets the top rank gets admission into that particular school or college. But this right here in US, it's a little different, and I think it's more better because with the interview, with the personal interview, the person who's taking your interview can see your body language, assess you. They can like read you, like how dedicated you are and how important um, becoming a dentist here in US is for you. So many things. So it is very nerve-wracking also. So I can imagine what you all are going through. Anyway, that is about interview. About bench test, um, you can start preparing. What I had done was I had gotten from Home Depot, I had gotten the compressor, and I bought hand pieces from Amazon. I'd got those cheap ones, like $15 or $16, but they didn't work really well. So I had to like change one or two times after buying the first ones. I got the burrs. The names of the burrs are also different here. We are not used to the names of the burrs. Like there's a burr for 33, 33 and a half. There's a 29 burr for making the class 2 cavity. So also there are like 7404 and so many different kinds which you should look up. There must be many. There must be a lot of information, and you should also look at the textbook. I recommend Rosenstiel and Schillenberg. Just look at the pictures, how the preparation is, how the ideal preparation should be on a typodont tooth, and try to follow it. Try to keep the photos in front of you and prepare it so it's more better, and you'll be getting close to ideal. Uh, for me, I think pros wasn't such a big deal. For me, making the ideal class 2 cavity was more challenging because I had not done that since a long time, and many of us like are not used to working on plastic teeth also. So for me, everything was, in the beginning it was a little hard. Yeah, on the plastic teeth it cuts so fast, so you have to be very careful. One more suggestion, I know we use high speed handpieces for making the cavity preps and the crown preps, but what you can do is you can do the gross reduction with the high speed, and then you can move on to the slow speed burrs. There is a different handpiece for the slow speed. It's called a friction grip handpiece, so you can use that, and you can try to do that. The refining should be done with slow speed, I think. That helps. So like with high speed, you're not keep going on till the end. Now about bench test, I feel that of course they are looking for a person with good hand skills, but everything can't be perfect. So basically what they are seeing is, at least do you know the basics? Do you know that the taper should be this much? Do you know that there shouldn't be an undercut in your crown prep? Do you know that this tooth needs a functional cusp bevel? They'll also see the clearance, if you have enough clearance. And if they tell you if it's that it's an all ceramic crown, then you need to do the appropriate amount of reduction. If they tell you a gold crown, then yeah, it's not a lot of reduction. It's like very thin, feather edged or a very light chamfer kind of a margin. So for them, it's these things are very important. For class 2 cavity, you have to make sure that the axial depth is about 1.5. Now, when I say axial depth, I'll try to draw. This is your cavity. Suppose this is your gingival floor, and this is your axial pulpal floor. This depth right here, when you see from the top, that depth, they want it like 1.5 minimum. And they also want you to reduce the gingival contact, and they also want you to kind of break the buccal and the lingual contacts. Some of the schools want it, some don't. So if you go for the bench test, you can just ask them before the bench test that how do they like it. The exit angles they're very particular about, so please look up exit angles. It has to be like 90 degrees. Um, Also, do you have enough depth, the depth of the cavity? So you have a periodontal probe, you can measure that with that. There's also enamel hatchet. Okay, enamel hatchet, the thickness is 1 millimeter. So if you want to check how much it is, you can also use that instrument, because there are some schools who don't give you a lot of instruments. So you have to be like in minimal possible ways, you have to try to figure out if you have reduced enough or no. Some of the schools like wax carvings, it's basically they'll just show you like a photograph or a picture of any object, and they'll tell you, okay, just carve this on a wax block. So those wax blocks are similar to those which we did in India in the dental anatomy lab. So similar to that, they'll tell you to carve a tooth, or they'll tell you to carve anything, honestly. But major of the schools like class 2 cavity and crown prep, because this is how class 2 cavity, in that they actually get to see your hand skills really well. It's very tough if you go to see every little detail of it. So that's why I think they like these two. But of course you should be prepared to do like multiple things, and the school will give you the information what they want you to do. Coming to your applications, I know we have experience, we have work experience. That is the most important, I think, in India. And don't think that I don't have work experience in US and I cannot get admission into any demo school. It's not like that. Your experience in India or any country matters to them, and they will see it on your resume or your application. I think a few things to enhance your applications: if you have any research, if you have like kind of helped a little bit to any PG student in India, try to tell them to, if they are writing a paper or publishing an article, tell them to include your name and tell them that you will help with something like editing or doing some sort of help. Like, I mean, you should contribute to something and try to include your name in some of the publications. Now, if you have your own research, get it published. If you have your thesis, get it published. And published, I mean, if it's good if you publish in a PubMed journal. So PubMed is a website in which they are very standardized. They have highest honor journals. So it's really good to have your article in one of the PubMed websites. But if you think that your article or your case is not so good to be included in a PubMed, you can just apply anywhere. There are so many journals and there are so many opportunities. I kind of did not do in my PG, but then when I started preparing for applications here, I also started working on my publications, and I kind of published my article in one of the PubMed journals. So that was a good push for me. Actually, otherwise I wouldn't have done that. But it's always good. And now when I go back, I type my name in that, I see like 3 citations. So 3 of them, or 3 of the articles have my article's reference. So feels good. Anyway, if you have that, do that. Volunteering. Here, after coming here, for me, like I couldn't understand where to go, how to do it, but I came across Red Cross. We all know that. So they have like a very organized process. They have on their website, there's a volunteering opportunity. You have to go apply on that website, and they will call you like for a very short interview. They would just ask you what would you like to do, because there are many things that Red Cross does, and how would you like to travel, and are you good in driving. If you have good driving experience in US, then you can help them out. I told them that I don't have a lot of driving experience, so I told them that I could help in a blood donation uh, camp or something. So I used to go and in the morning, and I would register the patient's name and just ask them a little details, and I would just guide them where to go. So I went to like 4 or 5 of them, and then I went to a tree plantation volunteering event, and there are so many now. You just go online, search, and there people are always looking for someone um, who wants to help. You can go to some age nursing homes. They need some help because there are old people or people who cannot like walk, or they are not very mobile. You can help them with their needs. So there are so many opportunities. It's all about research, guys. Whatever you think of, just keep researching, and you'll find so many things. It's all about trying, I think. And after that, CE courses. Now I had a few CE courses because I did my masters, but you can still do it. There is IDA, that is Indian Dental Association, and you can like at the local areas of IDA, like IDA Mumbai, you can go on their website and see they have so many CE hands-on courses which are a little cheaper than the private ones. So you can try to do multiple, and you can try to include those in your resume. The more the better. And try to include the recent CE courses first and then the older ones, because you may have done some course 10 years back, but that doesn't count so much. Like, that's not so important. Like, you have to show that you are constantly motivated to learn new things. So if you show something that you've done something recently, it would make more sense to them, that okay, the student is really interested in learning and doing more things. So try to do that. Make your nice resume. If you need professional help, or you need like templates from internet, you can just download them. Some of them are like paid, but it's not a lot, so you can just download the template, add in your details, and it gives a better visualization. One more point. If you want to spend a little money to kind of enhance your application somewhere, I feel that money was worth it, because that kind of makes you stand out in your application, and that will increase your chances of getting into. Now, one more thing when I talked about learning was the schools want someone who they can train you know that a person who's with the attitude that, oh, I'm an international dentist, I've done this, and I don't need to learn anything anymore. Those students are like red flags for them. They are not going to take you. So if you go for any interviews, just be very humble. Just try to ask others what about them, like what did you do, where did you work, where did you practice, all those. And only when you are asked, I think you should talk. Because I gave so many interviews, and I realized that most of them are trying to brag about themselves. Some were really nice. I made a lot of good friends, and they are still my friends, and we are in touch. So you will meet a lot of new people, and you will see on the day of interview that, like you, everybody else is nervous and tensed about getting into school. It's becoming really highly competitive, so I think you have to be on top of your game. I also feel that You should practice really well. I also feel that you should talk. If you have got an interview or at a particular school, you should kind of try to talk to the international students there. You kind of get a little perspective about that school or about that professor who's going to grade you for your bench test. So at least you have a little idea and you perform in that direction. Um, in bench test also, they have a limited time, so you have to make sure that you kind of plan your stuff. Like if at all, they will tell you that we give you 3 hours to do a crown prep and a class 2 cavity. Now you know if you are good at crown prep or class 2. So if you feel that you're not good at something, I think you should start with that so that you can spend some time doing that, and then you should have like a plan in your mind that 1.5 hours I'm going to do this, and 1 hour I'm going to do my second one, and the remaining half of that time or remaining 30 minutes I'm going to improve on refining of my preparations. 5 minutes I would give for like cleaning the models. So if you're going for bench test, make sure you have like wet wipes so that you can wipe the typodont. And since you don't have water when you're preparing it, it's gonna be very dusty and very flaky. So get those wet wipes, nicely clean it out, nicely at least clean out the tooth which you've prepared, blow a little air and try to get all the dust out. It's all about presentation. It's all about how you present yourself. If you show a dirty model or you present a dirty model to them, they'll be like, this student doesn't care, you know. So they see your overall personality, and they see how good you are or how you can be a good fit in their school. I am not remembering anything else as of now. If you have any questions for me, you can email me on my email address. It's ketschougule number 06@gmail.com. Whatever help you need, I'll try to answer those questions, because I remember my time. I would bug a lot of people, and sometimes I would get some response, sometimes I would not. So don't feel bad if you don't get any response from the front person. It's just because they are kind of struggling, or they are maybe like they are stressed about something. So don't expect everybody to help you. I feel that you should keep trying, but you should see if the front person is ready to help you or not. And try to talk to as many people as you can, I think, because many people will tell you, so 10 people will tell you 10 different things, honestly. But I feel that you should trust a person who you know that they're not going to misguide you or something, or try to talk to a senior who will tell you a little better and not your competitors, because there are some people who might not guide you well. So be careful about that also. And I think that's it for the preparations. If there's anything else I can add on to the video or make another video, I don't know, but I think I covered most aspects of this whole journey. Now this whole process for me, it took like, I started studying in 2016 and my school started in 2018. So you should give yourself a time of like 1 to 1.5 years, because all this takes a lot of time. Sometimes it can even take 2 years. But I feel NBDE should be given sooner. You are not going to be 100% prepared till the very last day. So don't try to postpone your NBDE. Try to give it as soon as possible, because the faster you give that, the faster your process will go ahead. And honestly, you cannot think about multiple things at the same time. Your first thing should be your exams. The second thing, or maybe like the documents also come before your exams. Try to get all your documents in order, and while you send your documents to your university, to school, or to some professor, you should start working on the exam part. Once you do that, after you pass, only then you can like start with your applications. One more suggestion, when you can start your CAPID anytime. Usually it's better if you start from the cycle. Okay, like suppose I think 2020 cycle of CAPID starts in March. So you can start your application, you can start entering all the information, like your name, your all the details. You can start entering your CE courses, like your statement of purpose, everything, and then in the end you can like transfer your NBD and TOEFL scores. Why I'm saying that is because there were so many things which after opening my CAPID application, I could I thought that, oh, I have to do this also, oh, I have to do that also. So like very minor small things, but I think it would be helpful. It's not like if you have started the cycle of CAPID and if at all it doesn't work out, you can't apply. Don't worry, the all the information is transferred from your last CAPID cycle to the new cycle. They will kind of ask you before that, do you want to transfer all your information from the last time, and you can go anytime and edit those information. But once you submit your application to that particular school, the main application, after that you cannot change anything. You can update your TOEFL scores, your NBD, pass or fail thing, but once your application is submitted to that school, they can't do anything. They cannot accept it. Make a list or an Excel sheet of all the schools, how much money they, how much is the fees, when is the deadline, what are the requirements. So make an Excel sheet of everything. Make your notes for your NBD part 1 and part 2. Keep following up with your documents, because some schools will inform you that, okay, we've received your TOEFL score, okay, we've received your NBD score, but some schools might not tell you, and you will keep guessing that what's going on. I think you should not bug them quite a lot, but at least you can ask them like every 10-15 days that, you know, did you receive my score report or whatever. Now this was like 3 years back. I don't know how it has changed in these 2-3 years. That's why I feel that you should also talk to your peers, or somebody who's done all this process recently, because there are many changes which keep happening over here, so you should be very updated. There are a lot of information on internet. Go and try to be active in those discussions. So many things. I know it's like a very big process, and understanding this process was a big challenge for me, but I had some really good seniors who kind of guided me through this whole process, and I thank them for that. I think the main thing is being very focused, very organized, being aware of what all things you need to be ready, where to spend money and where not to spend money. I would say apply to many schools as possible. Don't apply to only your state or only your area, because trust me, it's a span of 2 years. I know it's a lot, and some of y'all have family and you want to be restricted to that area, but I think if you want to get it done faster and if you want to improve your chances, I think you should apply to as many schools as possible. 2 years go by really fast. I'm almost about to finish my school, and it was a long journey, but I also learned a lot, and I had a good time at school. You learn so many things. So many things are new and different here. You have to get used to all the work culture and how everybody is. So it's kind of a challenge, and it's very exciting also. So and after you get your license, it's like totally worth it. So I would recommend everybody to work really hard, and I, whoever I knew, whoever I met during my interviews, um, all of them have gotten into dental schools now. Some of them got admitted in my year. Some of them could not make it in that year, but they kind of tried hard again the next cycle, and they got in. So don't feel sad or upset. I think it's just about the journey. And also, if you're trying to apply second time, you have to kind of, I think some of the schools will ask you, are you applying to this program for the second time? And you say yes, because, and I think they consider you a little higher as compared to the others who have just applied for the first time. When you apply for the second time to the same school, they feel that, okay, this student is really interested in our school. I think we should consider, I think we should call them for interviews. This is my thought process. How much ever I've seen schools and interviews in US right now. So yeah, so I think you should do that, and I cannot think of anything right now. So let me know, and good luck, and don't give up, just keep trying. Thank you. Bye bye.